Good evening, sir. Good evening, everyone. This is the 37th episode of our NOC DigiConnect webinar, in which we will be having this COVID Epid updates, which will be the 37th episode of the COVID Epid updates. And this will be delivered by our Senior Vice President, Dr. Rajiv Kumar Jain. And as you all know that this COVID situation in India is still, it is decreasing, but it has not touched the bottom. And the cases which were there in February, like on 9th of February 2021, there were about 9,000 cases, and still we have not touched that level. So it means that still the number of active cases are very much there, and the number of new cases which are coming daily, they are also very much there. And we had been deliberating this issue for last 1.5 years. We have covered almost 71 episodes of our NOC DigiConnect webinar series, and COVID Epid update is the 37th episode, which Dr. Rajiv Kumar Jain has been taking regularly to apprise every one of us about the COVID situation globally, regionally, and locally also. So today we don't have any guest speaker because we thought that we should take the guidance from Dr. Rajiv Kumar Jain regarding how we should proceed during this festive seasons, because now people are in a mood that COVID has gone, but still the COVID is very much there, and we have to take all necessary precautions during this festivity seasons. And as governments, they are opening up the schools also, and after these Deepavali vacations, these schools for children, they will be opened up to 8th classes also, and governments are taking their conscious call where to open the schools and where not to open the schools. Vaccination drive, we have almost covered about 90 crore people in India. And all these things, we would like to know the updates from Dr. Rajiv Kumar Jain, who is our Senior Vice President of AUSD, and he is member of the Management Committee of the Scientific Committee on Epidemiology in Occupational Health, which is a committee of subcommittee in International Commission on Occupational Health. And he is also fellow of AUSD, and he has been guiding us, and I would request Dr. Rajiv Kumar Jain sir to start his deliberation so that we can have enough time for discussion on how to proceed further with the evolving pandemic. So you have to unmute yourself. Dr. Rajiv sir, you have to unmute.
Hello, good evening. As Dr. Sandeep has very rightly mentioned, COVID-19 is still on in our country and globally. It is not gone. If you see the real situation of the epidemiological situation of COVID-19 today. But before that, today is October 2nd. And on this day in 1869, the father of the nation, our own Mahatma Gandhi ji, was born. And today is an important day for India and the world. So on this occasion, I'd like to share with you his favorite bhajan, Vaishnav Janto Tene Kaye, before we start our COVID-19 epidemiological update. Not this one, not this one. not this. Vaishnav Jan to tene kahiye.
Yes, sir. This is the one, sir. I am playing.
Yes, yes.
वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे। वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे।
वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे। पर दुखी उपकार करे तुए मन अभिमान नाने रे। वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे।
सकल लोक मान सहुने वंदे। सकल लोक मान सहुने वंदे। निंदा ना करे के नीरे।
निंदा नगरे के नीरे। वाच काच मन निश्चल राखे। धन धन जननी देनी रे। वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे। वैष्णव जन तो तेने कहिए जे। वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे।
दुखे उपकारे करे तोये मन अभिमान नाने रे।
सकल लोकमा सहुने वंदे।
निंदा न करे के नीरे। जीवा थकिय सत्य न बोले। भर धन नव ज्वले हाथ रे।
वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे।
वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे। वैष्णव जन तो
तेने कहिए जे। महामाया व्यापी नहीं जैन। दृढ़ वैराग्य जेनो मन मारे।
रामानमाशु तालिलागी। सकला तीरथ तेरा तार मारे।
वैष्णव जन तो तेने कहिए जे पीर पराई जाने रे। पर दुख उपकार करे तोये मन अभिमान नाने रे।
वनलोपिने kapaterakice kam krora. Ivarare सर्वजन को देने कहीं जे पेड़ पराए लाने दे।
So friends, having listened to this favorite bhajan of Gandhiji, we are once again reminded of interconnectedness of the entire world population. And it is all the more emphasized by the current COVID-19 pandemic. It is not only the suffering of India, it is the suffering of Asians, it is the suffering of Africans, it is the suffering of South Americans, as also the suffering of America and Europe as well. And together, if we face up to the challenge, only then we shall be able to overcome this pandemic and get over with our own lives and livelihood in the months and days and years to come in future. Because there will be more pandemics. So let's assess the COVID-19 pandemic situation from the epidemiological perspective. Let's first see the global situation. If you look at the graph, globally, the numbers of weekly COVID-19 cases and deaths has continued to decline. Over 3.3 million new cases and over 55,000 new deaths were reported during the week from 20th to 26th of September 21. Decreases of new 10% as compared to the previous week for both cases and deaths. The largest decrease in new weekly cases was reported from the Eastern Mediterranean region, 17%, followed by the Western Pacific region, 15%, the region of the Americas, 14%, the African region, 12%, and the Southeast Asian region, 10%, while weekly cases in the European region were similar to the previous week. The cumulative number of confirmed cases reported globally is now over 231 million, and the cumulative number of deaths is more than 4.7 million. The number of new weekly deaths reported showed a large, more than 15% decline for all regions except for the European region, which reported a similar number of weekly deaths compared to the previous week, and the African region, which reported a slight increase of 5%. The largest decline in weekly deaths was reported from the Western Pacific region with a 24% decline as compared to the previous week. And you can see in the graph the entire history of the COVID-19 pandemic globally, with the WHO regions shaded differently for each region. Like Americas is in yellow, Southeast Asia is in violet, and Europe in green, light green, Eastern Mediterranean dark green, Africa in blue, and Western Pacific in purple. So you are seeing how the virus has evolved from one WHO region to the other region right from 1st January 2020 till today. Next slide, please. This is the data, and you can see globally 10% decline in new cases over 7 days compared to the previous 7 days, and 10% decline in deaths with this week compared to the previous week. If you see the new cases reported, out of 100 cases reported, 38 were from America, Europe 32%, Southeast Asia 10%, Eastern Mediterranean 6%, Western Pacific 11%, Africa 3%. While in the case of deaths, out of 100 deaths, 43% deaths were from Americas, 26% from Europe, 9% from Southeast Asia, 8% from Eastern Mediterranean, 9% from Western Pacific, and 5% from Africa. But if you look at the entire position on week, you find 5% increase in deaths in Africa and decline all across in numbers. The highest decline in number of cases week on week was from Eastern Mediterranean region, minus 17%. And in case of deaths, it was from Southeast Asia, minus 20%, and Western Pacific, minus 24%. Next slide, please. This is the graph of the pandemic from each region of the WHO. Right on the top is the region of the Americas, and you find the fourth wave still on in the Americas, which means North America and South America. On the right side in green is the fourth wave in Europe in green, and you find still the fourth wave is still on in the European region of the WHO. Now we come to Eastern Mediterranean region, which is a little bit darker green. On the left, second top is Eastern Mediterranean region, and you again find wave after wave, which is higher than the previous one, and the fourth wave still very much on in Eastern Mediterranean region. A dramatic fall in cases in Southeast Asia region is visible in the violet graph on the right side in the middle, where the decline is still on, but it is not yet touching to the bottom. It is still showing the higher numbers compared to what we had in February 21. If you look at the African region, if you see the height of the graph, the third wave is still on in the African region, and it is progressing in the form of third wave. Now, surprisingly, in the Western Pacific region, you find gradual increase in each wave. And at the moment, it is the sixth wave. If you look at each wave, and the highest wave is currently on in Western Pacific region, and there is no sign of its declining even to the top of the fifth wave. So that is the reality in epidemiological terms of this pandemic in the world. Next slide, please. This is the up-to-date COVID-19 situation as on date, taken half an hour back at 6 p.m. from the WHO coronavirus disease dashboard. If you look at the cases newly reported in the last 7 days, out of 35,50,000 cases reported, 13,98,000 reported from Americas, 11,07,000 from Europe, 3,59,000 Southeast Asia, Eastern Mediterranean 1,92,000, Western Pacific 4,01,000, and Africa 90,727. In terms of deaths, last 7 days, 57,000 deaths reported. Americas reported 24,800, Europe 14,700, Southeast Asia 5,400, Eastern Mediterranean 4,034, Western Pacific 6,113, and Africa 2,471. Let's now look at the condition in terms of countries. These are the countries ranked from high top to bottom. Now you see cases newly reported, again, out of 35,50,000 cases, United States 8,92,000, Brazil 2,48,000, United Kingdom 2,26,000, India 2,13,000, Turkey 1,93,000, and so forth. You find the pandemic is still on across the continents, across the regions, and across the countries, across different regions of the world. Next slide, please. This is in terms of deaths newly reported in last 7 days. It is 57,000 deaths, out of which 14,000 from United States, Russia 5,600, Brazil 3,700, and Mexico 3,478. Next slide, please. Next slide. Yes, this is the coronavirus disease map of the world, where you have shown the population 1 lakh per 1 lakh population COVID-19 cases, and darker the color, darker is the most concentration in terms of per lakh population. And you see the dark brown are there, countries are there all across the continents, right from right in Asia to the left in Africa and America as well. Next slide, please. This is the COVID-19 deaths per 1 lakh population reported by the countries. Darkest blue is highest reported in last 7 days per 1 lakh population. And again, you find there are countries which are very dark red, dark blue across different regions of the world, right from right side to left side. Next slide, please. This is the position in Southeast Asia region. Where both cases and deaths have declined for the past 2 months. In the past week, over 3,44,000 new cases and 5,200 new deaths have been reported, and decrease of 10% and 20% respectively as compared to the previous week. All but 2 countries in the region have reported declines in the new cases the past several weeks. This week, the highest number of new cases were reported from India and Thailand and Indonesia. 7 of the 10 countries in the region have reported decline in weekly deaths, with notable decreases reported from Nepal and Indonesia. Bhutan did not report any new deaths, while Maldives and Timor-Leste reported similar weekly figures as last week. The highest number of new deaths were reported from India and Indonesia and Thailand, with a decrease in all the countries. Next slide, please. Excuse me. Yeah, sorry for the interruption. 29,551 new cases, 291 deaths, and 15.9 lakh tests yesterday. 7-day average TPR is 2%, 2.94 lakh active cases, shrinking by minus 1.8%. Total 3.36 crore cases, 4,46,690 deaths, 84.83 crore vaccination doses given. That is the current position. Next slide, please. Yes, this is we can go to the next slide, so we will know better. Next. Yes, life expectancy had been hit hardest since World War II. The COVID-19 pandemic has caused the biggest drop in life expectancy since the Second World War. So according to a new study by the Oxford University researchers, years of progress have been wiped out. Researchers at Oxford University's Leverhulme Center for Demographic Science found that 27 of the 29 countries for which they surveyed the data recorded reduction in life expectancy in 2020 and at a scale that wiped out years of progress of mortality. Women in 15 countries and men in 10 countries were found to have a lower expectancy at birth in 2020, in 2015, and a year in which life expectancy was negatively affected by a significant flu season. According to the authors, for countries such as Spain, England, and Wales, Italy, and Belgium, the last time such large number of declines birth were observed in a single year was during World War II. More than 8 years have been lost for females in 8 countries and for males in 11 countries. On average, it took these countries 5.6 years to achieve a 1-year increase in life expectancy. American men have been hit hardest. Of the 29 countries, males saw larger life expectancy declines than females. The largest was observed among males in the US and saw a decline of 22.2 years relative to 2019 levels. Losses in life expectancy were largely attributed to increased mortality above age 60 years and linked to official COVID-19 deaths. What the findings mean? Life expectancy refers to the average age to which newborn will live if current death rates continued for their whole life. It does not predict an actual lifespan, but provides a snapshot of current mortality conditions. It also allows for a comparison of the size of the mortality impacts of the pandemic between different countries and population. Difference in life expectancy in 2020 versus 2019, it has been shown, and you can see how there has been a decline in male and females. In USA, minus 2.23, Spain, minus 1.44, Belgium, minus 1.19, Poland, minus 1.5, Italy, minus 1.25, England, minus 1.14, Austria, minus 8.1, Hungary, minus 7.1, minus France, minus 0.67, Sweden, minus 0.87, Germany, minus 0.38, and Norway, minus 0.18. So you find all across, males mortality has been more, there's been more decline than female mortality. Next slide, please. Another landmark, a quarter have been fully covered. Almost 1 in every 4 eligible Indians is now fully vaccinated, while another 43.5% have been partly vaccinated. The milestone approaches at a time when the number of active cases of COVID-19 in India has dropped below the 3 lakh mark for the first time in at least 6 months. 8,76,087 crore 61,89,412 shots administered till September 28. Next slide, please. Delhi's death turnaround. Only March 2020, the very first month of the pandemic in India, has seen fewer deaths than September 2021 data shows. 25,087 total COVID-19 fatalities have been reported in Delhi till date, out of which only 5 in September 2021 and September 2020 were 970. And you are finding a steep decline in number of deaths. Most deaths in a month were 8,090 in the month of May 2021. Next slide, please. Why should we be concerned about waning immunity? That is another question which we need to examine, because there is demand for increased immunization and booster doses. For people who have received the first dose sometime in January this year, they are demanding. So the research has to be done as to what is the pace of waning immunity. More than 21 months into the pandemic, there remains critical information that remains unknown about SARS-CoV-2 and the disease it causes, COVID-19. One of these topics is whether immunity conferred after vaccination or infection wanes over time. Knowing whether or to what extent immunity may wane in the mid to long term is critical to inform the public health response and policy decisions. Here, we focus on waning immunity following vaccination. We describe the different ways in which scientists have studied changes in vaccination effectiveness in people who have been vaccinated over time and provide a summary of the findings thus far. Does immunity wane after vaccination? Yes. Multiple COVID-19 vaccines have received emergency use listing from WHO based on vaccine efficacy results from randomized controlled clinical trials. However, the follow-up time of the clinical trials used to assess vaccine efficacy for EUL was shorter than the usual follow-up time for trials of other new vaccines, with most efficacy results having a median follow-up time of 2 months. Outside clinical trial settings, vaccine effectiveness results among persons immunized as part of the national vaccine rollouts was similar to the findings of the clinical trials in the first few months after vaccines began to be administered. However, despite the encouraging results of the early vaccine efficacy studies, the duration of reported protection for COVID-19 vaccines require continued monitoring because in vitro studies of neutralization by vaccine-induced antibodies showed that levels of most vaccine-derived antibodies declined over time. However, it is important to consider that the antibody responses is only one part of the immune response. It is not known what level of antibody in the body is needed to provide protection against SARS-CoV-2 infection or severe disease, nor whether vaccine-derived memory cells will be activated in response to subsequent exposure to SARS-CoV-2, nor whether any observed decline in antibodies correspond to decreases in vaccine efficacy, and if so, or what time frame. Next slide, please. Vaccine coverage has been uneven in 2020's festival hotspots. During last year's festival season in October and November, COVID-19 infections shot up in 10 states, even though they had begun to subside in the rest of the country. As this year's festival season approaches, these 10 states need to exercise caution, as only 16.4% of their population has received both doses of vaccine. That is the data which is showing. Last year, during the 2 months when India celebrated Dussehra and Diwali, the first wave of the pandemic was receding. Average daily cases fell by 45% during this period. However, in 10 states, that is Delhi, Gujarat, Haryana, Himachal Pradesh, Madhya Pradesh, Punjab, Rajasthan, Uttar Pradesh, Uttarakhand, and West Bengal, cases went up by 17% post festivities. While these states have given 784 doses per 1,000 population as of 30th of September, higher than the national average of 645 doses per 1,000 population, there are variations within the states. The top performer, Himachal Pradesh, has administered 1,122 doses per 1,000 population, 2.5 times more than Uttar Pradesh. Similarly, while Himachal Pradesh and Delhi have recovered over 30% of the population with both the doses, Uttar Pradesh has covered only 8.5%. The number is 16% for West Bengal and Punjab. Worryingly, the pace of vaccination slowed down during last week in these states by at least 2.1%, with the exception of Delhi and Uttar Pradesh, where it grew by 2.1% and 12.3% respectively. Broadly, in India, vaccination pace has dropped to 7.1 million daily doses from 9.75 million last week. Next slide, please. This is the vaccination coverage below 500 doses per 1,000 population in the 5 states. And on the right side, you are seeing the red as both the doses and at least 1 dose in gray. Percent population vaccinated has been shown, and where you find Himachal and Delhi have leading vaccination coverage among states most prone to festive surge. Other states, you are seeing the difference in the first dose and both the doses. Next slide, please. Post-birthday lull. This is India has dropped by 2 spots in vaccination coverage growth. India slid from the top to the 3rd spot in weekly vaccination coverage growth among the most populous countries. The drop was due to a marked slowdown after the record 22.8 million doses administered on Prime Minister Narendra Modi's birthday on 17 September. Coverage growth slowed to 5.6% from 7.9%. Bangladesh and Indonesia reclaimed the 1st and 2nd positions respectively. Bangladesh ramped up its pace by almost 1.2 times, thanks to a nationwide campaign its government launched on 28 September to vaccinate 8 million people to mark its Prime Minister's birthday. Indonesia is also accelerating its vaccination drive after it received 122,400 AstraZeneca doses from Singapore early this week, as it seeks to reopen its tourism-dependent economy. At the current pace of 50 doses given per 100 people, Indonesia lags behind its Southeast Asian peers. It is currently weighing in on a proposal to administer a free 3rd dose to its 114 million strong lower income population. And on the right side, you're seeing the bar diagram where the data is shown. On the right side in gray, cumulative COVID-19 vaccination per 100 people, where Bangladesh is 24.9, Indonesia is 550, India is 62.7, Japan is 129, Philippines is 40.3, Mexico is 76.7, Brazil is 109.7, and Russia is 61.5, while US is 116.3, and China is 152.8. While if you see the weekly change in COVID-19 vaccine doses, 100 people in percentage, it's Bangladesh is 7.6 and Indonesia 7.4. India at third position with 5.6. Next slide, please. This graph shows 407 districts have reported less than 10 cases in the past week. New confirmed cases in each district in the last 7 days are shown district-wise entire India. North 24 Parganas, 814, Nadia 408, Aizawl 5038, Ernakulam 14,220, Thrissur 13,952. So India reported 1,76,086 cases this week, down 18.6% from last week, and its lowest since March. Only 10 states have reported more cases this week compared to last. Each of them reported fewer than 150 new cases, except for Tamil Nadu, West Bengal, and Mizoram. Tamil Nadu reported 105 more cases than last week, mostly owing to Thiruvarur district, which reported 124 new cases this week. 14 of the 23 districts in West Bengal have reported an increase in infections this week. 6 of them, that is Kolkata, North 24 Parganas, South 24 Parganas, Nadia and Howrah and Hooghly. All neighboring districts account for 64% of total cases. Cases in Mizoram rose from 16th straight week as its weekly tally crosses 9,000 cases for the very first time. Aizawl accounted for 65% of the state's cases, and Kerala has 143,546 active cases, the highest in India. But its weekly tally confirmed cases has been declining. Next slide, please. In Kerala and Maharashtra have reported most deaths in the past week. In this graph, you're seeing the rolling 7-day average of deaths. India has reported 2,009 COVID-related deaths this week, 5.3% lower than last week, and its lowest toll since late March. 8 states and union territories have reported no new deaths, while 15 reported fewer than 10 each. Kerala's weekly deaths have dropped below 1,000 this week, but still more than the next 8 states put together. Maharashtra, at number 2, reported 347 deaths this week. 11 states have reported more deaths this week than the last. The Haryana government added 64 deaths to the official tally earlier this week due to a reconciliation exercise. Most of them were added to the district of Sirsa, 40, and Rewari, 12. In the other 10, this week's tally rose by less than 15 each. While the infections and deaths have come down, last year's experience shows that they can go up during the festive season. It's key for India to accelerate the pace of vaccination. Next slide, please. Yes, before we finish off this epidemiological update, there is a video where Government of India's position is clarified, where the Health Secretary and Secretary Health Research have made substantive statements. We shall share that video with you.
Looking at data every day where you show us how many healthcare workers and frontline workers get vaccinated, we're still looking at 99% healthcare workers first dose and 85% second dose. So what do you think is the problem? Because healthcare workers were prioritized first in the entire country when the pandemic broke out. In fact, more frontline workers have received first dose than the healthcare workers also. My second question is in continuation. Do you think that healthcare workers who were initially vaccinated would now require booster doses? Because we've seen that there is waning immunity after vaccination after some months.
The second part of your question, I would request Dr. Bhargav to answer. But the first part, we have also taken this up with the states. There are certain specific states where the second dose coverage is on the lower side, and we have drawn their attention, and we have provided a facility in the CoWIN system where line listing of people who have missed their second dose can be generated. So states have got those lists and they are looking at these people and trying to ensure that second dose is given to these people. And about the booster, I think Dr. Bhargav would be the right person.
Okay. I think currently I would say that the talk of booster is not pertinent, and I said this last time also. The call of the hour is to give the 2-dose vaccination, or which we call as full vaccination, covering the entire adult population. That has to be the goal, that is the agenda, and that has to be continued. I'll just add one more point. We have had some studies from in India where, including Bangalore, from some hospital where they have looked at the antibodies, and they have found that antibodies are persisting for much longer. More than 95% of the antibodies persist for up to a year. Therefore, the concept, the talk of booster dose is not pertinent at the moment.
Thank you so much.
With this, we shall also be sharing a video where the issue of air pollution and COVID-19 has been addressed in terms of question answer session by Vismita Gupta Smith and Maria Naria of the WHO. Kindly play that video, please.
Hello and welcome to Science in 5. I'm Vismita Gupta Smith. We are talking today about WHO's new air quality guidelines, and our expert is Dr. Maria Neira. Welcome, Maria. Maria, tell us what is new in WHO's new air quality guidelines.
What is new, essential, is that we need to lower the recommended levels of exposure to air pollutants in order to protect people's health. So we know now that even exposure to a very low levels of certain pollutants that we are breathing every day will put us at risk. And that's why for 6 key pollutants, we are recommending lower levels that will be protecting your health. The important message of these guidelines is that if those recommendations of WHO are implemented, particularly for PM 2.5, which is one of the most dangerous for our health, we could save 80% of the total number of deaths that we have every year due to air pollution. And that number is 7 million premature deaths caused by exposure to air pollution. So as you can see, Vismita, we have an incredible opportunity here that we cannot miss to protect our health.
Maria, elaborate please on these 6 pollutants that we must control in the air that we breathe.
Yes, there are 6 pollutants that are very much of concern for our health. One of them is the so-called PM, so particulate matter 2.5. It's such a small particle that can go very easily to your lungs, and from our lungs will not stay there. It can go even to the bloodstream, and from there reach any organ in our body. Then we have PM10, which is a little bit bigger, and then other 4 pollutants that are coming essentially from traffic or from the combustion of fossil fuels. And I'm sure that you heard about SO2 or NO2 or ozone or carbon monoxide. All of those 6 are the ones that we are targeting. And if we are successful on implementing those new recommendations and lowering the levels of those 6 pollutants, we can save many, many lives.
Maria, what have we learned so far about COVID-19 and air pollution?
It's clear that the bad quality of the air we breathe will be a major risk factor for acute and chronic respiratory diseases and cardiovascular diseases. In addition to that, if you are exposed to air pollution, you will develop certain diseases, underlying diseases, that will give you a greatest possibility of develop severe cases of COVID if you are affected. So we see a clear relationship between air pollution and the burden of COVID-19 in places that were very polluted. This is an additional reason why now on the recovery post-COVID-19, we need to reimagine a greener world with clean sources of energy, a place where we can breathe air that is not killing us. Just to remember all of the people that is listening to us, at the moment, 90% of the world population, 90% of the world population is breathing an air that is not respecting the recommended standards by the World Health Organization, the ones that will be protecting our health. Most of the decisions about the reduction of air pollution, they need to come from governments, from mayors, from politicians, but as an individual, I can put pressure on my politicians for them to reduce those levels of air pollution and therefore protecting my life.
Thank you, Maria. That was Science in 5 today. Until next time then, stay safe, stay healthy.
Thank you so much for your patient listening. That was a review of the COVID-19 epidemiological situation as on date. And I must thank for your attention and your generosity to spare your time from your busy schedule.
Thank you, Dr. Rajiv sir, and all the panelists also for joining, and the participants for getting this COVID review, Epid updates, which is the 37th issue. And on this auspicious day of birth anniversary of our Father of Nation, you have reminded us that there are a lot of things which we have to do without any prejudice, and that we should do a selfless service. And in this Enoch DigiConnect webinar services, they are a selfless service to the our OH and industrial health fraternity. And on this day, we thank all the participants, all the panelists, all the guest speakers who had been part of this great initiative. And we have already put all these videos on our YouTube channel. You all can go and visit them in your leisure time, and they have been arranged in the sequence with their topics over there, so that you don't have to worry what is there inside this recording. So this today's day also remembers, as you have rightly said, it also reveals that we are all interconnected to the entire world. And this was an endeavor from Delhi side, from Enoch side, that we all need to be connected during this difficult times, and especially during this difficult COVID-19 pandemic. And as you rightly said, pandemic is still very much there, and it has definitely affected our day-to-day lives and our day-to-day norms also, norms of working also. And what has been highlighted is the life expectancy has also been hit hard after the World War II. So in a way, COVID pandemic is still affecting our lives, and this waning immunity and uneven vaccine coverage, they are also a great threat. So we should all advocate, we should do the advocacy for vaccination for everyone. And since booster dose is still under scientific consideration by the scientific community, so we have to wait till their final judgment comes. And the WHO air pollution guidelines, they are also quite important and relevant during these tiring times. And it has recommended the 6 prominent pollutant levels, that is PM 2.5, PM 10, and the fossil fuel petrol combustion resultant like SO2, NO2, ozone and carbon monoxide, since they are very important in the etiology of respiratory disease and cardiovascular disease. So we need to take care of them also. So it was a great learning session for today. So I would request panelists, if they have any questions or any comments, they can raise their hands they can unmute themselves and they can ask the questions. They are Dr. Pawan. You have to unmute Dr. Pawan. So, Dr. Rajiv Jain, I would like to ask one more thing, that what about the vaccination for children? It will be there, as government has told, that it will be there in November. So the schools, like, they will be open in November only. So will it be mandatory for the students to get vaccinated and then go to school, or the school is not like a school opening is not at all connected with the vaccination?
Well, Dr. Sandeep, you asked a very relevant and important question, because this question is a concern for all the parents. Well, it is very clear that children nowhere in the world are required to be vaccinated for them to attend the schools. However, the, the school teachers and the staff, the support staff of the school need to be fully vaccinated if they are working in the school on a physical form. Well, the second part about the vaccine, ZyCoV-G vaccine has been authorized for emergency use authorization, and that is for children 12 to 18 years of age, but no vaccine has yet been authorized for children below 12 years of age. Now, for the vaccine ZyCoV-D, which has been authorized, the government of India is taking a decision that it should be shortly available. The decision of launching this from the government of India side is at the moment at the negotiation stage, where the pricing is being determined, because this vaccine requires 3 doses instead of 2 doses, number one, and the administration is through a special applicator, because you don't use a syringe to vaccinate 12 to 18 years group as you conventionally do for the adults. There is a special applicator like you have for insulin administration, so it will be painless. So 3 doses and special applicator. So the costing is being finalized, and it will not be available in the market. It will only be administered through the national program. At the moment, current thinking in the NAGVAC is that it should be available only to specified comorbid condition affected children of 12 to 18 years of age. Now, those 2 COVID-19 comorbid conditions have to be yet to be determined.
Sir, you have to unmute yourself. There's some technical problem. Shivang, there's some technical problem with Dr. Rajiv.
In the meanwhile, if Dr. Sharma, if you allow, can I ask
a
question that's coming to mind? Good evening to everyone.
Yeah, sure.
Thank you so much. Thank you so much. So I know that our esteemed panelists are here, and also a good number of attendees. who were present. If at all I missed somewhere gathering the information that what happens to the to all the people in whom even after vaccination they are not developing antibodies. I'm sure in a couple of our webinars also it has been discussed. Somehow I'm failing to recall. Both the vaccine shots have been taken. Probably even the person was under COVID sometime. But then also when antibody tests are being done, there are very low levels or maybe negligible levels. So anyone can please suggest what should be done in that case. Anyone from our esteemed panelist or audience?
Can you just repeat the question again, Dr. Pawan?
Yeah, sure, Dr. Sharma. It's about antibodies not developing even after second dose of vaccination, whether it is Covishield or Covaxin or Sputnik. If a person has taken and after like 15-20 days or a month of second dose, they are going for antibody check and they see that the counts are still not there or they don't have maybe a good number of antibodies. The body has not reacted to the antigen and antibodies have not developed. So what has to be done for those people who have already taken a couple of both the shots of vaccine?
No, actually, Dr. Pawan, this vaccine for Covishield for this COVID, actually it affects both the T cell immunity and the B cell immunity. So if even in many cases the immunity is very much there because of the T cell, so cellular immunity is very much there and it protects the body. So antibody levels, they are not an indication that you have developed enough resistance or not against COVID. So antibody levels, they are a misnomer. You don't need to go for antibody titer and create any anxiety regarding that, whether you are properly vaccinated or you are not vaccinated. If you have received the 2 doses, then you'll be awarded this fully vaccinated certificate. And as per the results, as per the scientific studies, at least for 6 to 7 months, your body is given protection, whether it is by T cell immunity or B cell immunity. Mainly it is by the cellular immunity. So you don't have to worry about the antibody titers.
Great. Maybe I thank you so much, Dr. Sharma, for clarifying. I was getting a couple of times family members also approach. They get their antibodies done. Usually, most of them have the titer.
That is a futile exercise. Actually, you don't have to.
Yeah. Actually, it is not prescribed also to get the antibodies done after vaccination. Actually, it is said you don't have to go for it. But yes, as you rightly mentioned, people get anxious, and I'm also getting queries. Maybe I would have read, but this clarifies a lot. Thank you so much.
Dr. Pawan, actually, I'd like to tell you, we can give assurance to all these people by saying you have taken both the doses. There is no need to go for antibody titer checking. Whenever antigen or the virus will come in your body, the memory cells will produce the antibodies.
Perfect. That's all. Thank you so much, Dr. That's really appreciated.
Right, sir.
Thank you.
So
I'm sorry, I had some urgent work at home, so I had to attend. But the question Dr. Pawan was asking was relevant.
Yes, sir.
The issue of vaccine effectiveness will remain, and the questions uncertainty around it shall also remain. But at the same time, we have to remember the vaccine is the only option for reducing hospitalization and reducing mortality. So infection, of course, will happen, but vaccine has its important role. And another new development which has occurred in US is evident. Merck has developed a pill where 50% reduction in hospitalization can occur. So initial results now are very encouraging. Let's see FDA give its approval. Then the oral option will also be available, where hospitalization could be reduced. So that's a good development in terms of science advancement.
Thank you so much, Dr. Jain. That really clarifies. I really appreciate gesture of all panelists and also yours for answering, taking the query. And that definitely a good development of US. Thank you for sharing. Really appreciate.
So Rajiv sir, there is one question from Dr. M. Kulkarni. The corona pill is now available in market. Is it for prophylaxis also?
No, it is not. The current indications are very limited. It is not prophylaxis. It is for people who are affected, and you will get to know more in the days to come. Let the FDA give its approval. The company has already only applied to FDA for its emergency use authorization.
What is your information regarding this Covaxin approval? Because now with the easing out of the travel norms, people might be willing to go abroad. So Covaxin approval is still not there. So people are
with the current discussions in the WHO, the regulatory approval is in the process. Earliest I can expect by the end of October, the approval may come. It is all the data, additional data was demanded by the experts group. It has been submitted. They have to convene again. So by end of October, we should expect substantive progress in terms of Covaxin being authorized. As you know, for the problem with the Covishield is also there with UK, and India yesterday required all the travelers from UK to have the same 10 days isolation. In addition, 3 times testing, that is before departure, on arrival, and 8 days after arrival in India. 3 times testing for all arrivals from UK. So that has been done by Indian government based on reciprocal arrangements, because Indians, when they go to UK, in spite of them having received the Covishield vaccine, they are being subjected to the same procedure. So India has adopted the same procedure yesterday. It's a, I think it's a very effective way to tell that we cannot discriminate in the world, because AstraZeneca and Covishield are one and the same vaccine. Yet UK has not recognized the vaccine exemption for people who have received Covishield. So let us wait for Covaxin, the results from WHO, and then other countries will react and take necessary policy decisions following the WHO clearance. But more important from a global perspective is that once this Covaxin goes into WHO approval phase, COVAX facility will be utilized. As you know, Government of India has allowed from next month, it's use and export to countries which require Covaxin. So that I think is also important. Covishield also was facing a restriction by Indian government that is being relaxed by Government of India. So it should be able to go to other countries which India wants to send or export, the company wants to export. So that's also a positive development. But I believe the major development which has happened in the last week, I feel the substantive push to vaccination which has been given. Specifically, I would like to recognize Madhya Pradesh, which was in the bottom 7. Now it is in the top 4 in terms of vaccine doses. So there is a substantive progress, and September has been phenomenal. September has been phenomenal because in terms of total doses administered in September, entire 30 days, 23 crore 61 lakh 71,973 doses have been administered in September. Imagine in 1 month, India administering across states with different geographies, more than 23 crore 61 lakh vaccine doses across the world, across the country. So the development, I think it's very progressive, and we should hope that by 31st December, at least all the adult population has received the 2 doses, and simultaneously we are seeing substantive progress on ZyCoV-D for children aged 12 to 18 years, which would be rolled out anytime in this month. The Health Secretary in the last yesterday's press conference said he was not willing to commit because he said very soon was his terminology, and he specifically said he would not like to commit a particular date for its administration, because the fine tuning of the eligible population of 12 to 18 is being done at the moment. So let's wait for that to happen.
Right. I think with this, with the availability of the vaccines, I think we will be covering about 100 crore of the adult population, at least with one dose in the month of October. And
Very true.
And
In fact, today only we have touched 90 crore.
yeah. So
Only 10 crore are left. So if yes, in September we administer more than 23 crore. So we would reach more than 100 crore surely, but we can cross 110 crore in October itself, the way things are moving.
Even in many companies now, they are very much strict about the vaccination, and they have issued circulars that even in our company also, we have issued circular that if you are not vaccinated, then you won't be entitled for any medical benefit if you develop COVID.
Very true.
Already we have already covered 95% of our employees, but for the dependents and other people who are entitled for medical benefits, if they are not getting vaccinated, then they won't be entitled for any medical benefit, and their disease, if they develop COVID, it won't be covered. So gradually,
it's a very progressive step, I feel.
Yeah, now companies are getting stricter regarding this COVID vaccine administration. So I think
90%, more than 95% have done it voluntarily. I think for the rest registers, some kind of from the employer side, some kind of carrot and stick policy will work.
Yeah. So I think, sir, with this, we have got a lot of insight about the COVID evolution last week, and we hope that vaccination drive will further improve, and we all will take all necessary precautions as a responsible citizens of India, get ourselves vaccinated and try to get other people also vaccinated who are resistant or who are hesitant to take the vaccine. And we will remain safe with following all the COVID appropriate behaviors, and we will meet next week. Another question by Dr. Kulkarni before we leave: how do you confirm the T cell integrity before the actual exposure to possible infection in question? Will that answer I give more confidence, sir?
Well, I feel T cell integrity is not the only factor. It is the cellular immunity also is important. And that is what makes all the things very uncertain. It's very difficult to determine as to what in a particular individual, what is the immunity which is affected, and how the cells, not only T cells, but the entire bone marrow cells are going to respond in terms of infection by particular virus or its variant. That is I think it's studied at the moment. There are 5-6 studies at the moment which are studying this aspect. Let's wait for the results to come and then published in peer reviewed journals, and then we can share this aspect. But thanks for asking this question.
So with this, we conclude the session for today, and recording will be available on the INOC DigiConnect webinar, and those who have missed, they can see it, and links are all already, we have distributed the links. It is INOC DigiConnect webinar platform, and all the videos are available over there. So thank you all very much, and we'll meet next week.
Thank you so much.